to you and welcome to Adelante Chicago. Bienvenidos. I'm Lourdes Duarte. Thank you so much for joining us. The increase of mental health issues like depression, anxiety, PTSD, and the lack of accessible and affordable services, especially in many of our underserved communities, can make it very difficult for people to receive the proper care they need. The organization Healthcare Alternative Systems is trying to break those barriers by offering services particularly to those with limited resources. Here to tell us a little bit more about how they're making that happen is Luis Sanchez. He is the Community and Marketing Manager for Healthcare Alternative Systems. Hello to you. Thank you for coming in.
Hi, thanks, Lourdes. How are you?
Good, good. This is such an important topic, not just within our Latino communities, but all around Chicago, all around the country, right? And so what you've done is you've developed what I call like a friendly space, which
Correct.
you have nicknamed or named the living room. So tell me about that.
Sure. So a little bit about our organization, actually, Healthcare Alternative Systems. We're a 50-year-old organization that started back in 1974. So we've been in existence for quite some time now. But we also focus on other issues, obviously mental health being one of them, but SUD, anger management, domestic violence, and gambling prevention. But we specifically focus on the living room, and this is focused on mental health crisis. So we have two of them that are currently in existence. One of them that is currently 24/7, 365 days a year.
And where is that?
And that's located in 5001 West Fullerton in the Belmont-Cragen area.
Okay. And so is the idea that you go in there if you're in a time of crisis or something's happening in your life, and it's a very sort of safe space, friendly space for you to walk in and ask for help?
Exactly. Instead of going to the ER or being hospitalized for...
And that's what it looks like right there. We're looking at images.
Yeah, definitely. Instead of going to the hospital or an ER, it basically is a safe haven, a safe space for folks to come in, check in if they're suffering from depression, anxiety, or they just want to talk to a peer counselor. That's what we offer. We offer those services for folks to actually feel like it's like a safe haven, a safe space for folks to actually unwind or just talk to in general, and not have to go to an ER, or not have to go to a hospital to get sort of just clinicized, or to actually be part of the hospital system.
You know, and I think a lot of people would hear this and would say, is it really that simple? Is it really as simple as you walking in saying, I'm Lourdes, I need help, this is what's going on in my life?
Believe it or not, it's actually that simple. I think, we have peer counselors, so individuals who are there to counsel folks as they walk in. And just to give you a typical day, and if you express anxiety or depression or something, you just want to check in. You walk into our lobby area, you're greeted by an individual. The person takes your information. If you don't want to, you don't have to. But it's a confidential space as well. So folks come in, they can sit in the living room space if they feel like they need to. We have a library. We have some coffee, tea if they're looking for that. We have recliners, folks to actually just decompress. But if they want to talk to a peer-to-peer counselor, we have that as well. So there's someone who can actually take the individual, talk to them, and give them either some services, help, or refer them to another program.
Yeah, and I think that's the idea, is to show them the resources that are out there and what they can do. So the folks, the peer-to-peer counselors, wouldn't necessarily prescribe anything or tell them what to do or things like that, but it would guide them in certain directions.
Exactly. And the key thing is, obviously, you just sort of decompress and de-stress and sort of alleviate the stresses that we have every day in life. I think, a study came out recently that said 1 in 5 Americans are expressing high anxiety, depression, mental health issues. And so luckily we have, 2 living room centers that offer these opportunities for folks to decompress and, sort of alleviate those stresses in life.
So you said one is in the Belmont-Cragen neighborhood. Where's the other one?
The other one's in our West Suburban Cook County office, which is in Broadview, Illinois.
Okay. Are there plans to open other ones?
Currently, that is the plan. We are looking to see, one, how the 24/7 center operates and if it's fully functional and how it's working. So far, it's been a success. We've had a lot of individuals, primarily in the Black and Latino communities. We serve over 80% of our participants are of the Latino or Black race. And so a lot of it is, we want to help those communities, but we welcome everybody. So it's not just, a one-stop shop. So.
Okay. Overall, your system, your health system, addresses these issues not just at the living room, but on a broader scale, right? So after they go into the living room, let's say, how would you help them? How would you be able to help them?
So we specialize in other services as well. If for example, if they're suffering from drug use or if they're suffering from domestic violence, we do have special programs or special workshops within the living room, and so we express them to actually be part of that, right? And as I mentioned, that this is a confidential service, so that they don't have to be, their name doesn't have to be out there, or they don't have to give their individual name. But we offer them workshops, we offer them other services, and if we can't provide a service, we'll refer them to one.
And I think sometimes in our Latino communities, language is oftentimes a barrier, so maybe people might be hesitant to go and visit because they think, oh, well, they're not going to speak Spanish, they're not going to understand me. Is there any truth to that?
So you'd be surprised. One of the things, we've been in existence for 50 years, and what we always stress is that Healthcare Alternative Systems started as a bilingual multicultural organization. So we are bilingual. We do have individuals who speak Spanish. And so we have that ability to actually educate, but also give them that peer support that they need.
It's so important. This issue of mental health has seemed to really affect, as you mentioned, our Latino and our Black communities. Do you feel like there's an improvement being made? Are you seeing a change? Because a lot of focus and a lot of dollars has been going to that to try to address that issue of mental health.
You'd be surprised. In the beginning, there's always that stigma, right? In the Black and Brown communities, there's a lot of stigma of getting self-help, getting mental awareness in one's life. And so I think the ability to communicate and to sort of foster that sort of community around oneself is important. And I think that has to be established, and that's what Haas actually does.
Okay, Luis, if people want more information or they want to reach out to you, where should they go? Is there a website, a number?
Sure, absolutely. We are at www.haascares.org, and our main number is 312-850-0050.
All right, there you go. There you see it. Thank you so much, Luis. We'll talk to you again soon.
Great. Thank you, Lourdes.
All right.